The draping, it definitely takes some practice. We have used 2 sheets on top. I was mentioning to Chris that at the spa where I work, because they have pretty much removed blankets because of COVID, we do use 2 sheets and for modesty for the client. And also this time of year, it's a little bit chilly, so people want to be warm. So, any questions? Okay. Chris says that he does prefer lotion. To be honest with you, it's rare that I actually use lotion, so this will be fun for both of us. Don't worry, Chris, okay. Don't worry. Typically, I either use massage cream or actually I use oil quite a bit.
Is cream like thicker than lotion?
Yes, yes, it is. And it has a little more of the glide of an oil, and it absorbs a little more like a lotion. So, and depending on the person, for some people it just works really well. I prefer it, especially for people who happen to have more hair, you know, because you don't want to make someone uncomfortable, okay? So to do the undraping of the anterior leg, you want to fold up your sheet and make sure that you have got quite a bit of the tail up. Then you will move it up the leg, and you would typically use the arm that is closest to his leg to lift and then pull the sheet up. Now, at this point, depending on how high the drape goes, you can either fold or roll, you know, with keeping modesty in mind. And then you will tuck underneath securely. Another thing you can do, if someone has their arm on the outside of the sheet, you can invite them to hold the end. For some people that may feel more secure. But Chris seems like he feels pretty secure at this point.
Yeah.
Okay, good.
By the way, it's Krish.
Yep.
Krish, oh, I'm sorry.
There's a little H on the end there.
Oh, okay, well, thank you for letting me know.
Okay.
It's okay to correct me.
Got it. Names.
Names are all good.
Yeah.
So, now, do most of you use lotion when you are massaging at this point?
Yes,
Any oil
sometimes.
lovers?
There's a lotion oil mix that some of us use.
Yeah, the gel.
No, it's like
It's
a
just a mix of lotion and oil. We use that a lot too.
We haven't really
Classmate.
worked with just oil.
Oh, you haven't?
We just haven't been using it.
Okay.
I used it once.
We
and I thought
can,
it was weird.
but.
You thought it was weird?
Yeah.
Gotcha.
Would you put another bolster under his ankles, or just depends on the client?
Depends on the client, yes. And I understand that you guys do some reading of the strokes beforehand. So when I used to teach a particular class, we called it popcorn reading. And what that means is that if you feel like reading, you just pop up and you don't have to stand up, of course. So can someone please read the first?
Stand in a lunge position at inferior end of table facing client's head. Outside hand is placed on distal lower leg with fingers pointed towards center of body.
Okay.
Inside hand is butted up behind outside hand with fingers toward outside of body.
You want
Okay.
the points too?
Now, I obviously have used an incredible amount of lotion, which is great for my hands. So you wanna keep, was that the whole
It was
section?
the opening effleurage circulation stroke.
Okay.
You want all the little bullets read too?
Yes, please.
Okay. With hands in this position, flow up the leg.
Mm-hmm.
Glide proximal to the knee and take a step if you need to maintain good body mechanics. Glide up thigh prior to reaching the drape.
Mm-hmm.
Hands fan up, fingers facing superiorly. With fingers facing superiorly, glide to the feet on the lateral and medial aspect of the thigh and leg.
Okay.
Repeat. On some of your strokes, when you glide distally, glide your hands under the thigh on the posterior aspect of the thigh with your fingers facing each other. As you glide, pull up gently and traction gently. You can add a bouncing movement.
Okay.
As your strokes get deeper, squeeze the thigh as you stroke proximally. You can change your hand position to accomplish this. You can even use loose fists. You could also hold your hands in a C shape with the outside hand on the lateral thigh and the inside hand on the medial thigh. Or
Okay.
experiment with whatever hand position gets the best squeeze.
Okay. Whew, that's a lot. Thank you, Morgan. It's a lot of steps. So, of course, we're going to start lightly, and as we warm up, we will go deeper. Now, do all of you use a holster for your lotion?
I like to wear an apron that has pockets.
Okay,
Put it in my scrub pocket.
I put it on the table.
okay,
It varies depending on everybody.
absolutely, absolutely.
Would you put lotion on your forearms also? 'Cause I noticed you using it.
It actually kind of gets on your forearms, that's a great question, but as you're coming up, you end up with it, but you certainly could, yes. Now, Chris, are you finding that there's some pulling?
With the lotion?
Yes.
Not at all.
Okay, good.
Like I put coconut oil on my own body, like at home and stuff.
Excellent.
But I just guess lotion is for massage for me.
Yeah, no, that's great.
You wouldn't incorporate the feet?
I'm sorry?
When you're doing the first, you wouldn't incorporate the feet?
I mean, you certainly could. I know in a session, would I? Yes. But we are doing. People do love traction. So don't be afraid to give a little tug on the foot. Okay, so what is the next section? Somebody else want to read?
Alternating hand circulation stroke.
Okay.
This stroke is performed like the circulation stroke above, with the following differences.
Mm-hmm.
One hand glides up the lower leg and
Mhm.
thigh and wraps and molds its way back to the beginning position parallel to the body part, while the other hand waits to start its perpendicular glide until the first hand starts its way back. So when one hand is facing fingers up at the proximal thigh, the other has the fingers facing the side of the ankle. Both hands move continuously as one unit in an alternating rhythm. At the end of the stroke, one hand is proximal thigh while the other hand is at the ankle. And the middle of the stroke of the hands pass, one on the medial side, one on the lateral side. Repeat 1 to 3 times.
Okay. So it's really just alternating what you're doing.
And you'll recognize that a lot of these are very similar to what we did on the prone leg. One of the main differences is just that the shapes of the muscles that you have access to in the supine versus prone position. Of course, you get the quads really well in this position. And also just with the bend of the knee, it's easier to get under the leg when they're supine. So similar strokes, but you can get even more under than when they're face down. And then with our deeper work, we're going to get into these, you know, quads and peroneals and tibialis anterior, all the good stuff.
Yes, and you know, depending on the person you're working with and the height of your bolster, because this bolster is actually quite a bit smaller than the one that I typically work with. Or whether you have a pillow under the knee, or some people don't want anything, and then that makes it a little more challenging, but. Okay, so what is the next, was that all of the bullets?
That was it for alternating hand circulation.
Okay, perfect. And what's next? Someone else wanna please read the next section?
Go ahead.
V-stroke on thigh. Place outside hand on lateral aspect of distal thigh with hands forming a V shape. Spread thumb and fingers to form V opening.
Yep, so, I'm sorry,
No,
Dan.
go ahead.
So, you're kind of like a bird, okay?
With inside hand form a V opening and belly behind the outside hand. Hands move up and down the body of the unit, molding and shaping to the contours. Perform as a build-up stroke using several small movements instead of one long one, ending each small stroke on a slightly higher up part of the body. Pressure is equal in both hands, but is deeper when pressing in a proximal direction. As you repeat the stroke, deepen your pressure by sinking in with your index fingers.
And again, this is similar to something you have done when you worked on the prone thigh, I'm sure.
And of course, you're getting deeper and deeper as you work with this stroke, and you can really get into all the layers of the quads, and you can access all the quads with this. So you saw Jill really getting into that vastus medialis around the inside of the knee. And you can get a rectus femoris in the front, and then vastus lateralis on the lateral side.
Right, and what is a little different about the vastus medialis over here? What's the shape that makes it a little bit different?
A teardrop.
It is a teardrop, yes. And of course, you do want to be careful of the IT band as it is close to the knee. And a lot of people have very tight IT bands, and that's something that you will hear from a lot of your clients. But nobody wants you to dig in really deep as it gets near the knee.
Would it be different if you're working with an old injury or just the same?
I think it depends on the injury, of course. Because actually Chris was sharing that he does have some old injuries, but he thinks that and he does think that there still is some scar tissue in here. But he's been working very hard for 10 or 11 years to
Oh, yeah.
take care of that, so. Okay, so what is the next?
Quadriceps thigh,
Okay,
folding aka broadening.
okay,
Pivot to a straddle position facing thigh, quadriceps thigh. Grasp the tissue with both hands, lift it up and away from the bone while spreading it out laterally.
okay.
Repeat the movements until the tissue feels warm and easy. Elastic. With heels of hands facing each other, grasp the tissue between fingers and palm and slowly squeeze muscle out of the hand by moving heels of hands slowly towards fingers. Avoid pinching. Be careful not to tickle the medial thigh. The medial thigh can be a sensitive, vulnerable area. Heavy, slow, deliberate strokes with clear intention are helpful to avoid being pushed.
Yep, so you're pulling and lifting, and again, you're not tickling, you are very intentional about this. Any questions about this?
In this position, if you wanted to do range of motion, would you cover up them again and into it?
Range of motion of the hip, I think then I would definitely ask them to hold the sheet, actually hold both portions of the sheet, and then I would lift the leg in that fashion, because if they are holding the sheet to really keep things modest, then you should be in great shape. And they should too. So, what do we have next?
Forearm iron thigh.
Okay.
Stand in lunge position with your
Mhm.
front foot approximately even with the knee or at the middle of the thigh. Use your forearm or loose fists and begin at the distal aspect of the thigh and glide superiorly.
Okay.
Softly drag your hand back to your starting place. Move lateral slightly overlapping the last stroke and repeat. Repeat moving lateral until you have covered the entire thigh. Be aware that the IT band may be very tight and tender, in which case you can cover that area with broad hands. Repeat deeper. The quads are often glued together, which must be released slowly. Often working deeply and too quickly will create a reflexive, tightening, armoring response.
And really using your forearms is a great way to cover a vast area of the leg. And it feels good to the client. And it also saves your hands, which is good.
Yeah, we can move on from the fulling
Yes.
a little quick, and I didn't get to ask this, but I saw that you were doing a particular stroke, and I was wondering if there's other ways that you like to do fulling as well, like with your palms or even
Yeah, absolutely.
forearm is almost like pushing against a bone or pushing against your forearm, and
Yeah,
there are other
absolutely.
techniques that you like to use?
Absolutely, yes. And again, it depends on what's going on with the person, Anna. Because a lot of people do come in with issues with the IT band. And then, yes, you can use fingers, you can use fists. You know, a lot of it is what's going to feel comfortable for you also. And yeah, maybe I did move on from that a little quickly.
Oh, that's all right.
But yes, there's as many variations as there are clients that will come in.
Can you show how you would do the forearm iron hand with your other hand? Just, I feel like the more dominant one.
On this particular leg,
This is Spanish.
to be honest with you, I wouldn't.
Use your other hand.
I wouldn't on this leg, I would, on this leg. For me, this is what really works.
Going from inside to outside.
And just really covering the whole leg. And I believe that, you know, if you wanted to go this way, you absolutely could do that.
Can you isolate the IT band so we can see the area that's good to rub and the area that's?
You should just
Yeah,
use hand
absolutely.
sanitizer. Is it okay if I jump in?
So this area of the IT band is the one that's most sensitive,
Mm-hmm.
right down near the knee.
Jill, can I show some other arm work?
Of course.
I got clients' permission to just use hand sanitizer, which I did. So, you can use both forearms together too. And if I was to use my left forearm more, it would be more for on rectus femoris or vastus lateralis, so either on the top or the sides. And when I use two forearms, I often like to kind of rest my arms together. I find that they get more relaxed and stronger and more sensitive that way. So some of your ironing